This is the final take. I'm going to do the whole lot in one go. My name is Jennifer Grant. I'm a clinical psychologist. I'm angry and exhausted. Get ready for a tirade. The acutely unwell clients I've seen this week and increasingly over recent years are not seeing me because of any mental illness. They're seeing me because they are being screwed over by the present government. Here's the headline list. 1. Housing for people with a disability. 2. Housing for when circumstances change. 3. Accessing income support. 4. NDIS. 5. Essential medications. 6. Delays in processing applications for permanent residency. 7. Poverty and healthcare. Let me tell you more by describing some of the clients I've seen this week, all identifying information change. 1 is about housing for people with a disability and a bit about the NDIS and AAT. Robin is a 45-year-old single woman. She has a serious and worsening physical disability and a complex relapsing psychiatric disability. Robin has a generous NDIS package. She's part owner of an old house that cannot be modified to meet her needs. She's been approved for NDIS long-term housing, specialist disability accommodation. Robin has an NDIS housing coordinator and a support coordinator, though the turnover of staff in these roles has been pretty shocking. Robin was relocated to an NDIS-funded medium-term accommodation unit in the middle of last year, then relocated twice more until February this year when an NDIS decision ended her MTA funding and left her homeless. An appeal to the AAT is in progress. Neither New South Wales Housing nor NDIS have been able to offer any solutions. Meanwhile, Robin is effectively couch surfing in totally unsafe housing. She is literally at risk of death, imminent death. And by the way, Robin has been hit with a bill for $4,000 to pay back the costs of the MTA that apparently exceeded her time limit. And a postscript. In the AAT urgent directions hearing, the NDIA was represented by a lawyer. Robin had her well-intentioned support coordinator representing her. The senior member presiding gave every impression of being very concerned about the seriousness and urgency of Robin's situation. The private lawyer, contracted by the NDIA, appeared without benefit of any briefing by the NDIA. He needed to go back to the NDIA and get instructions. The disempowerment of NDIS participants trying to get help up against contracted lawyers is gobsmacking. 2. Housing for when circumstances change. Debbie is a 40-year-old disability pensioner who lives with her brother in a private rental. He was working and paid the rent. He's had a heart attack, now disabled himself and unlikely to ever return to work. They have no savings. They can't pay the rent. Debbie's relapsing disability worsens with stress and anxiety. She's at risk of hospitalisation. He's dependent on Debbie to be his carer. They have no one who can help. They need somewhere to live now. They cannot compete in the private rental market. Phone call to housing was a nightmare. If approved for priority housing, and they likely eventually will be, they are likely to wait a year or more. Debbie will end up in a psychiatric facility or die by suicide before then. Her brother, if homeless, is high risk for another, this time fatal, heart attack. 3. Income support and Centrelink. Michael is a middle-aged man who has always worked and never before had to seek help from Centrelink. He suffered a sudden onset impairment last year and couldn't keep working. Mark kept himself going until he finally had to apply for JobSeeker in January. He has some investments, but not enough to live on, nor be able to be turned into cash. He lives in his own, heavily mortgaged home. He applied to Centrelink in January. He supplied a complete set of documents at the time of his application. He has a record of 24 phone calls, 39 notifications from Centrelink, and several visits. And the notifications include you're approved, you're cancelled, we need more information, you're been cancelled, you're approved, you're cancelled, please, we need more information, often for the stuff he's provided before. You've been cancelled and you're approved again. 5 months later, he's still waiting for a payment. He's been able to access some of his superannuation to keep paying the bills, damaging his prospects for a modicum of financial security in retirement. It shouldn't be that hard. For NDIS access, Priya's 2 children were recently diagnosed with autism. An awesomely capable woman, Priya had managed her kids' challenging behaviour, never thinking their challenges might be a sign of a disability until they hit school age. Wonderful teachers set her on the assessment and diagnosis pathway. Once they got the autism diagnosis through the Child and Youth Services at the hospital, who did a great job. These kids were more than 6 years old and too old to qualify for the NDIS early intervention pathway. The evidence required for accessing NDIS once you've turned 6 to have any hope of getting the support you actually need is a nightmare. Priya needs help to navigate the system, and the cost is prohibitive. Priya has to pay for multiple health medical practitioners to assess and write reports. Estimated cost of getting the supporting evidence for her two boys, $3,500. Medicare doesn't cover or subsidise any of those visits or the report writing required. Let's go to 5, essential medications costs. John is a 30-year-old on a disability pension. He has daily life-threatening seizure-like episodes. He requires an injection to relax his diaphragm and throat so that he can breathe. This has been costing him $40 a day, despite it being on the PBS, plus the costs of multiple other prescription medications. Nobody has been able to explain why, even with the PBS safety net threshold being met in the first couple of weeks of the calendar year, John is still paying huge out-of-pocket for his medications. He has multiple medical specialists involved in his care and a kind pharmacist, but no one still can sort this out. 5B, essential medications supply chain disruptions. Gwen is a 60-year-old palliative care patient being supported in her home. She relies on a medication called Tarjan to alleviate suffering from persistent and severe pain. Tarjan stock started disappearing from the shelves of Australian pharmacists in March. Doctors tell me there is no equivalent to substitute for Tarjan. Multiple reasons are given on the TGA website: transport, logistic issues, storage capacity issues, manufacturing. Why doesn't Australia have its own manufacturing capacity for essential meds? Why isn't there contingency plans to prevent such crisis? Delays in processing applications for permanent residency. Ella is a 20-year-old woman born overseas who came to Australia with her Australian-born adoptive father as a 9-year-old. She has been on a bridging visa ever since, awaiting the outcome of her application for permanent residency. Ella is desperately seeking assistance to find employment, to get help with her disability, access to healthcare, assistance with the cost of meds, and income support. Ella is somebody who's going to be able to contribute to this country, but after 9 years, she doesn't qualify for anything. Neither Ella, nor I, nor her parents, nor an awesome volunteer service that's also involved can figure out how to navigate the system and push her residency application along. 6, poverty and health costs. I need another couple of videos to cover the impact of poverty on mental health. But this week, as every week, clients called and ashamedly disclosed they didn't have enough money to cover the out-of-pocket costs of seeing me. They aren't seeing doctors. They're not seeing dentists. They're not buying their meds. They are choosing, wisely perhaps, to put some food on the table and try to meet their rent increases instead of seeking healthcare. Healthcare with a preventive focus that will reduce long-term costs and preventable deaths. As a clinical psychologist, I'm well aware that demand for mental health services far exceeds supply. All the individual cases I've briefly described have complex needs. 10 or 15 years ago, they would have been able to seek help from services that just don't exist anymore. Centrelink social workers, disability specialists within state government agencies, a housing welfare officer within a public housing agency, a legal resource centre. Or their complex needs wouldn't have arisen in the first place because our government would have been building a system and supports to protect the most vulnerable in our communities. I want to help my clients with their mental illness. This fractured, broken, outsourced, privatised system is causing mental illness. Please vote for change next Saturday. P.S. I live in Cowper. CAS for Cowper is committed to fixing this. Go CAS. Thank you.